Welcome to the Monument Health Cancer Care Institute's Oncology Clinical Pearl Sessions. I am your host, Nathan Matlock. I am the current PGY2 Oncology Pharmacy resident at Monument Health Rapid City Hospital Cancer Care Institute. Today, I have some information on a great new agent. It's called Tisotumab vedotin, or the brand name Tivdak. So let's get at it. So Tisotumab, what can we say? FDA approved September 20th, 2021. Indication, we've got a new player in the gynecologic field, recurrent or metastatic cervical cancer. Mechanism of action, it's a tissue factor or TF-directed antibody drug conjugate composed of an anti-TF IgG1 kappa antibody conjugated to the microtubule disrupting agent MMAE via protease cleavable valine citrulline linker. So Tisotumab vedotin's anti-cancer activity is likely due to the ADC binding of TF expressing cancer cells, followed by internalization, the complex, and then causes a release of MMAE via the proteolytic cleavage. MMAE disrupts the microtubule network of actively dividing cells, leading to cell cycle arrest and apoptosis. And we'll talk a little bit more further about that on the next slide. But adverse reactions. We really have a lot of things about the eye. This is one that we're going to have to pay special attention to. We're going to have special administration instructions, which we'll get to. But conjunctival abnormalities, 37 to 40% of patients. This includes including conjunctival hemorrhage, hyperemia, scarring, conjunctivitis, corneal abrasion or erosion. You can also have increased serum creatinine, hypomagnesemia, hyponatremia, hyperuremia, constipation, anemia, neutropenia, hematochezia, fatigue, and peripheral neuropathy, among other things. So here, as I promised, the mechanism of action in visual form to make it a little easier. This is the Tisotumab agent, and you can see here the anti-tissue factor monoclonal antibody on this end, and then the protease cleavable linker, this yellow. But then you have this MMAE attached on that little red dot. So essentially what happens is this monoclonal antibody binds to tissue factor that's being expressed on the tumor cell surface. It is brought in, this entire complex is internalized and brought into the cell. A lysosome essentially just degrades this, and upon that degradation, MMAE is released, and then it floats around as the cell is going through its development stages. This, while it's in metaphase, will disrupt this microtubule formation, and essentially it results in cell cycle arrest and then apoptosis after that. So next, we have Tisotumab dosing. So dosing is going to be 2 milligrams per kilogram, a maximum dose of 200 milligrams for patients greater than or equal to 100 kilograms. This is going to occur once every 3 weeks or 21 days until disease progression or unacceptable toxicity. So if toxicity occurs, there are dose reduction protocols. You can find these in Lexicomp. They're here. So you can see the usual initial dose, 2 mg per kg, maximum dose of 200 milligrams. First reduction, let's say they qualify, you can reduce the dose. You're going to go to 1.3 milligrams per kilogram. If they come back with toxicity and you can still reduce further, second time you're going to go with 0.9 milligrams per kilogram. If any toxicity occurs after that second dose reduction to 0.9, you're just going to discontinue Tisotumab if they're unable to tolerate that 0.9 mg per kg. So this slide, this is a snip from Lexicomp. I always like to point this out. It's kind of like a forgotten little pearls of wisdom, I would say. So this pearls and related information down here. We have this related information. So if we come up here, click that, up top, we are presented with these three options. If you click this common toxicity criteria, this will take you to the CTCAE information on toxicities for this specific agent, and then how to handle those toxicities and how to grade those out. Very handy, very unique. It basically allows you to bypass having to look at the CTCAE PDF and discern what you need and so forth. So like I said, Tisotumab is going to require extensive pretreatment requirements to protect the eyes. So first one, topical corticosteroid ophthalmic drops. We're going to need an initial prescription, and all renewals for any corticosteroids should be made only after ophthalmic examination. So these individuals have to go to the eye doctor, have to get an exam. The first drop should be administered prior to each dose of the agent. Patients should continue the eye drops in each eye for 72 hours after the infusion. The next is topical vasoconstrictor ophthalmic drops. We're going to administer these in each eye immediately prior to each infusion. An additional pre-treatment requirements, cooling packs. We have to use cooling packs during each infusion, and these can actually be swapped out. So if you feel that the cooling packs are getting too warm, just get them a new pack. It's important that these stay cool, constrict the vessels in the eye to prevent the agent from getting to the eye as much. So then we have topical lubricating drops. Instruct the patient to administer during treatment and for at least 30 days post the last dose. Then, of course, always concerned, contact lenses. Should avoid wearing them unless otherwise specified by their eye care provider for the duration of treatment. And then at that point, once the eye doctor says, hey, you're good to go, start using the lenses again upon their approval. As with all chemotherapy agents, we need to be looking at the emetogenic potential of these. So this actually qualifies as a low emetogenic risk. Then administration-wise, infuse over 30 minutes. We're going to make sure we have a 0.2 micron inline filter. It is not compatible with other medications, so it is going to need its own Y site and not be ran at the same time. Confirmed topical ophthalmic corticosteroids and vasoconstrictor eye drops have been administered prior to infusion. This is all over the package insert. We cannot forget this. So that's a quick snippet on Tisotumab vedotin, or brand name Tivdak. Again, big things I wanted you to take away. Make sure you understand that it has high ocular toxicities. We have to make sure we're paying attention to those. So like I have here, questions. This is recorded, but please, if you have any questions, comments, concerns, reach out. My email is nmatlock@monument.health. Feel free, email me. We'll discuss it. We'll get it cleared up. And yeah, thank you. I do have references here for your review. So that's it for today. It was quick and easy. I appreciate y'all, and I look forward to seeing y'all the next time. Y'all have a good one.